Hi, Jamie Davis from the Nursing Show here at ANIA in Philadelphia, the Nursing Informatics Conference. I'm sitting here with Kimberly Burress from CHOP, or Children's Hospital of Philadelphia. Everybody around here knows what CHOP is, and it's a premier children's hospital. But tell us a little bit about CHOP and what people might expect if they were to walk in the doors at Children's Hospital of Philadelphia.
Children's Hospital of Philadelphia is the preeminent children's hospital on the East Coast, and it really is a place where patients and families can come and get the best medical and nursing care. Walking in the door, we have spent great time, energy, and effort to really make it a place that is open and welcoming and friendly, so that when patients and families do come in the door, they're not overwhelmed by the medical facility itself, but instead feel like they're walking into, I like to liken it to Disney. It's light, it's airy, it's fun. We've got, you walk into the elevators and there's a child that speaks to you that says going up, going down, speaks to the elevator and the floor that you're going to. And it makes it not so scary to be sick. It's scary enough to be sick, but to walk into a place that makes you feel warm and fuzzy takes the edge off for both the patients and the families.
That's awesome, and just matches up with everything I know about CHOP from my experience. I have family members that have been there with their children and people I know, and they have nothing but nice things to say about it. So Kimberly, tell us a little bit about your nursing background and what drew you to nursing informatics.
I've been a nurse for almost 30 years now, and my background, I started off in oncology and adult health. I did a lot of years in adult women's health. And I worked at another institution where we were implementing a new electronic medical record for a labor and delivery unit, and very interested in technology and tech savvy. And as we had to develop this new project, I ended up being the project lead, and was so excited and passionate about implementing this that I went back to school and got a master's degree in information systems. And when the opportunity to come to CHOP opened up as an informatics nurse specialist, I transitioned over and have been here since 2011 and am now the program director of nursing informatics.
So what's going on with nursing informatics at CHOP? What are you guys doing with informatics in general, and what is that doing for how you take care of patients?
We are involved in every aspect of patient care. You cannot be a patient, nor can you be a provider of health care and not touch technology. It is now at the bedside of every single patient, from the computer at the bedside, from the nurse call system to the smart pumps at the bedside. Everything is now integrated through technology. And the electronic medical record that we use is EPIC. And EPIC is a system that allows patients and families to now talk to providers, talk to their healthcare givers through the application. And we're just touching into some of that technology now and being able to do using our patient portal to allow patients and families to schedule appointments, to give their providers messages. But in terms of nursing informatics, we're involved in every implementation of technology, and we end up being the translator between the IS community and our clinical community, which speaks two different languages.
Yes.
And we are the moderator and the liaison between the two, helping to identify those clinical workflows and how informatics can influence that, and how we make sure that that technology doesn't overwhelm our patients and families at the same time, but is a support system to them. So we're involved in every implementation that there is going on right now. We have some tentacle involved in that.
Real quick, and this is just kind of a separate question, where do you see nursing informatics going in the next 10 years, say, or informatics in general in healthcare? Because some of us have this dream that it's going to just help us have more time clinically at the bedside, because technology is going to do something for us to allow us to get back to that touch of nursing.
Right.
Is that going to happen?
It is. It will happen. I think you have to be very selective about the technology. The idea that an electronic medical record eliminates all paper. Not necessarily the case. And so we really have to be thoughtful about the technology that we're implementing and making sure that we're implementing technology for patient outcomes and not for technology's sake. And so nursing informatics helps us do that. We are looking at each type of technology to say, how is it going to impact our patients? Is it really a support to the patient? And does it support nurses and clinicians at the bedside? And so, yeah, I think we'll get there without question. And I think nursing informatics is on the cusp of being able to be incredibly proactive and be one of the first ones out there to say, look at this new technology and how can we integrate this in our workflows so that it does support patients and families and positive patient outcomes and support clinicians at the bedside. So absolutely, we can get there.
Well, thanks a lot for coming on. I appreciate it. It's great having you. Thanks. Thank everybody at CHOP for the wonderful work they do for the area and the community here in the Mid-Atlantic region. And we'll hopefully maybe get a chance to talk to more CHOP nurses when I get out to the Critical Care Conference that's coming up in a few weeks. But we're here at ANIA in Philadelphia for Nursing Informatics, and we're going to be talking more about this topic. So stay tuned to this channel or over at NursingShow.com as we bring you more segments from this amazing conference.